everyone. Welcome to the CCA Outreach Series. We are very excited to be here again today, bringing you a new video. Today, we're with Dr. Demetrius Coombs of the Craniofacial Center in Dallas, Texas, and we're going to do a Meet Your Surgeon interview. So this will be a lot of fun, and we'll just get to know one of our craniofacial providers. So Dr. Coombs, welcome to our interview series.
Yeah, Erica, thank you for having me. It's a pleasure. I'm happy to be here and spend some time answering questions, and I'm looking forward to it.
Awesome, awesome. Well, welcome. We always love to get to know the folks in our medical field. It's really fun to get to know you guys on a deeper level. So, I'll just start out asking you a couple of questions. And of course, the first question is always just tell us a little bit about yourself and who you are.
Yeah, I grew up in Salt Lake City, Utah. Big Greek community there, so I was very involved in that growing up. I went to Drexel in Philadelphia for medical school, which was awesome. Big change going from Salt Lake City to Philly, but wonderful city, met a lot of cool people and still many good friends. And then I went a little bit back further west to Cleveland to do plastic surgery. And when I decided I wanted to do craniofacial surgery as a career, I came down and did a fellowship with Dr. Fearon in Dallas and stayed on afterward and couldn't be happier. I love my job.
That is awesome. It is always fun to talk to people who love their job. I also love my job, and I also love Dr. Fearon. He did surgery for me in 2010, so everybody who knows me gets to hear that story eventually. So glad you are there in Dallas, and that is a big change. That leads me into one of my other questions. What's your favorite thing about Dallas or Texas as a whole?
So Dallas is really interesting in that Dallas proper, I feel, is a little bit like Los Angeles. It's
Mhm.
pretty cosmopolitan, it's pretty spread out. But there are these pockets that are all very interesting. And then if you want a totally different experience, like everybody that comes to visit, you have to go to Fort Worth. Because Fort Worth, even though it's technically a different city, they call it like DFW. And so you get the like Western flair, rodeos, totally different restaurants, totally different scenes. So you kind of get to live in two places at once.
Yeah, definitely. I really like that about Dallas too. And I feel like it's such a, like you said, LA, it's such a fashion town. It's always on the cutting edge for the middle of the country.
Yeah, it is.
Awesome, awesome. Well, one question is how and when did you know that you wanted to go into medicine? At what age did you figure that out?
Good question. So there's a lot of medical people in my family. My great great grandpa was a doctor. And for those of any viewers or you that are skiers, he was supposedly like one of the first doctors in Park City. His son, my great grandpa, was a cardiologist. My grandma went to medical school, and my aunt went to medical school. So growing up, I was like around all these medical vibes, but none of them were surgical people. So I remember my grandma when I was little explaining this kind of stuff to me, like this is medicine, this is surgery, this kind of stuff. And so I grew up and I said, I want to be a surgeon. I thought it was like the neatest thing in the world, surgery. But I didn't really know what I wanted to do surgery wise until I got into medical school and found plastic surgery. So I was like pretty determined. Just I needed a little bit more determination when I got in there to find what I wanted to do.
Absolutely, absolutely. Were you into the arts at all? Because I always say there's definitely an artistic side of plastic surgery.
Totally. My favorite class, well, when we were little, my mom would put us in all kinds of like art classes in the summer when we were growing up. I have two brothers, so it's like she probably needed some freedom and just had to put the boys, entertain them. But in high school, I took ceramics and I took it for 2 years. And it was like my most favorite class, probably. I made like teapots and pasta colanders and teapot and teacups, all sorts of different things and like my own glazes. And so it was just a nice way to kind of have some catharsis for the day.
That is very cool. That's awesome. It's great to go to a school where you're exposed to that kind of stuff too. So that sounds like a very fun class.
Right. It was great.
Awesome. Awesome. Along the way, you already mentioned determination. So along the way to this, It's a lot of school from for a long time. You've been thinking about this. What was the biggest challenge that maybe almost stopped you on your journey, or at least gave you the biggest headache? And how did you overcome it?
Well, I would say it's hard being in medicine, in medical school, and residency because you're on a very kind of linear path and you just have to get through it and have perseverance and work hard. But at the same time, life is happening around you, right? People are getting married, people are having children, you know, grandparents may be getting ill or family members may be passing away. So there's like this kind of world that's going on behind you. But at the same time, you just have to be laser focused. And obviously, you can take time and leave and stuff. But you know, I never got to a point where I was like, I can't do this. This is not for me. I always knew that what I wanted to be when I grow up, and I didn't really want to let something stand in my way. And I just had this mindset: if you work hard enough, if you just get through the night and study this material and keep going, it's all going to be okay. And I sort of feel like that. I mean, I ended up exactly where I wanted to be, even though I may not have known it 5 or 10 years earlier, what that place was.
Yeah, that's really insightful. I've heard a lot of people who do go to, onto advanced degrees. Life does happen around you, and you have to have, the faith in yourself that you're on a path that's going to get you there, even if it seems to be taking a bit of a while.
Yeah, and I mean, it's all relative too, right? Like if you go to law school, if you want to become a finance person in New York, if you want to be a psychologist or start your own business, I mean, it's all the foundations are all hard work and perseverance and being goal oriented. It's just how would you say it? The characters change, but the story is kind of the same.
Yeah, absolutely. Well, thank you for sharing that. Another question that I definitely like to ask is what changed for you? Was it the people you met along the way? Was it something about plastic surgery that really solidified this is what I want to do? And specifically in the craniofacial world?
Sure. So I'll answer part A first. So when I was in medical school, you got to pick the surgical services you could rotate on. And I thought, okay, transplant, that's wild. That's what I want to do. And then 2 days before the deadline, I said, okay, you know, I don't know if this is really for me. I want something that's more diverse in terms of the kind of patients, the kind of operations and things. So 2 days before, I switched to plastic surgery. And I met two guys in Pittsburgh and I rotated on their service. One is retired now, is Dr. Heckler and Dr. White at Allegheny General Hospital. And I saw things I didn't even know existed in terms of surgery, you know, skin cancer, excisions, body contouring, craniofacial surgery, like more from a trauma perspective, other types of hand surgery, breast surgery. And I was like, every day was just totally off the wall. And these guys were masters of anatomy and they loved teaching and just like it was the neatest experience that month on their service. And so then I said, okay, done deal, plastic surgery, let's go. And then that's how I ended up in Cleveland. And then when I was in Cleveland, we had a lot of senior guys in our department that were originally craniofacial surgeons. One was Dr. Zins and one was Dr. Gyron. Although they both do primarily cosmetic surgery, they were very much in tune with analyzing the face in terms of the bone structure and the occlusion and the position of the chin and all these things. And they would talk to me about, you know, kind of their earlier days when they did craniofacial surgery, as well as Dr. Pepe. I mean, he did a lot of intracranial surgery and craniofacial surgery kind of early on. And I could see, you know, there's something about how their eyes lit up and they talked about these operations and, you know, those days that made me really think this is awesome. And then we did some of those cases in residency and we spent a dedicated time at Akron Children's, which was like my first dedicated PEDS experience. And much like my experience in Pittsburgh, in Akron, I saw, you know, cranial vaults and bimaxillary surgery and all sorts of things I'd never been exposed to. And I was just, it was like drinking out of a fire hose. I thought it was just absolutely fabulous. And so from then on, I said, all right, next step, we're going to craniofacial surgery. And that's how it happened.
Very cool. Very cool. That's exciting. How, one thing leads to the next, and being open to those experiences really ignites a passion in you and our other medical professionals. Very
Yeah,
cool.
and the training is strange, right? It's like if you never interacted with like a couple of different people on the dotted line, you may be over here doing something different, but it's almost like, there's like this predetermined plan and you got to just follow the plan, I guess.
Yeah, for sure. Along the lines of talking about igniting a passion, is there one particular thing in the craniofacial world right now that you're interested in research wise? Is there something that's really piqued your interest, maybe at an ACPA conference or another one of the research and conferences that you go to?
Yeah, I think, there's a lot of debate in terms of like craniosynostosis, either syndromic or single suture. And it's two things. What's the best operation and what's the best time to do it?
Mhm.
And I don't think we've figured that out. There's so many smart people researching it and that get, tremendous results doing a variety of different things. And maybe that's like the beauty of plastic surgery, right? And craniofacial surgery. But that to me is the holy grail when a patient can walk in your office and you can say, this is the time we're going to do the surgery. This is the surgery we're going to do. And my sense is it's going to be a one and done. Obviously, there are exceptions to like one and done, but you know, um, that to me is like what I would want to shoot for and what I think the main unanswered problem is.
Yeah, definitely. I know that is a huge concern for our parents. So anytime you find someone who, whether or not we know definitively if it is the best, if there's a surgeon who feels they are doing their best work in a certain way, it's great to know that you all are out there continually educating yourself on that.
Yeah, I mean, it's like a lifelong journey. You need to be reading and thinking and doing and, interpreting and evaluating and criticizing yourself. I mean, it sounds stressful, but in a way it's fun because that's how you really be the best that you can be, I think.
Yeah, absolutely. Well, you mentioned it yourself, so I'm going to lead into this question. We're going a little bit out of order, but how do you manage stress? It is incredibly stressful, I would imagine, dealing with patients. And we like to laugh and say, we're not, doing brain surgery here, but you often are involved in surgeries that are that magnitude. So, how do you manage stress just as an individual?
Yeah, it's an interesting question because I mean, certainly there's small things that are stressful and there are bigger things that are not stressful. And I think, everybody reacts to those differently. In my way of approaching it is, whether it's a consultation or a surgery, it's all about preparation and discussion and communication. And I want to either leave the office or hang up the phone or leave the operating room knowing that I did the best that I could. I utilized information from all the training that I've received and I used all of my resources, meaning if there's a problem I encounter, I feel comfortable calling, whether it's my partner or old people from residency, old mentors. I think hubris and pride and arrogance are really bad things. And I just want to, if I ever encounter a certain complication or a certain problem, all I want to do is look back and to say, I did everything I could. And that's the best that I can do. And from like a more personal side of it, I guess, less of a professional thing, my wife is an anesthesiologist. And so she gets to hear the full thing every day, so she's a good source of stress relief. And I mean, for us both, I mean, she's seen some crazy stuff as an anesthesiologist, and she actually works at Parkland. So, I mean, she sees emergencies of all levels. And I think the most important thing is just having somebody to talk to and not being afraid to take the necessary steps or time or swallow your pride and ask for help, things like that.
Absolutely. That is one thing that we say a lot at CCA. Having someone who understands what you're going through and you seem to have those contacts from school, and your wife being in the same field generally, it seems like you absolutely understand that firsthand, that you've got to have someone who understands where you're at and what you're going through to share that journey with. So very cool. Thank you for answering that.
I think part of what I realized as a resident was a lot of stress can be eliminated by just taking extra time, right? Spend the extra 5 minutes with the patient on the inpatient service. And if that means getting to the hospital 20 minutes early, just do it. You owe them the time, you owe yourself the time. And the same thing in the office. If you got to run a little bit over, or the case goes a little bit long, or you got to stay till 6 and call the parents on the phone, just spend the time, because then you're not going to worry about all the little things later on. It's all about, time, I think.
Yeah, absolutely. I am a big fan of preparing before I do anything, and I agree with that a lot. So thank you for that advice. That's fantastic. Um, and I think you might have read my questions before. I know you didn't, but this leads right into the next
I wish I
question.
did.
Great, and it's just nice that this conversation has led to my next question, which is one I get asked the most, maybe, from parents, and one that I myself ask of myself. How is the best, in your opinion, way to prepare for surgery? Both physically, so that your body is ready to take on the surgery and recovery, and the best way also, if you have any tips for how to prepare mentally, specifically for younger kids.
Sure. So I think let's tackle the mental side first. So surgery is a significant investment in time, in emotion, and in many ways finances, right? Like, even though insurance may cover certain portions of it, you may have to buy things afterward you didn't account for, whether it's I don't know, dressing type stuff, or there are always unforeseen costs or what have you. And so I think plastic surgery is wonderful in that you have time, right? You have time to get second opinions, or you have time to talk to people, or time to read online. And I think many patients are maybe scared to ask questions, and you have to find a doctor and find somebody that you feel comfortable saying, like, I have a question. It might be, maybe not super high level, but what do you think? Because if you can walk into surgery comfortable, like much like we prepare for a case or for rounds or whatever, having done your homework, having read about it, having had all your questions answered, I think you're going to be in a much like safer kind of zen than if you feel like you were rushed, or you didn't know, or you don't understand, or you're confused about the plan. So, you want to feel good and get all the concerns out beforehand. In terms of like preparing your body and stuff, I would say there aren't many crucial things you can do. Um, the one thing I would say in a lot of the smaller kids that we perform like craniosynostosis surgery on, or the Fort surgeries, the one thing that comes to mind is, iron supplementation. So you want to ask, is my child, do they need iron? Do you recommend iron? How long should they have it? Or in the case of, we use recombinant erythropoietin, or EPO here, which is basically a drug that's naturally produced in your body, but allows your body to kind of stock up on red blood cells. So if you have a higher starting point and you lose some blood, you're a lot further away from the bottom. So it makes it safer. And in terms of those things, I think that's probably the most important. Um, with children in particular, it's different because they're not going to like cognitively think about it like an adult might. And like a 17-year-old is going to have different concerns and fears than a 5-year-old, or, like a 1.5-year-old. So I think you got to find a way, and whether it's through your doctor or the parents or what have you, to explain kind of at their level what's going on. And I think most of the fear is probably related to how they go to sleep. And, here in Dallas, I mean, like many anesthesia centers or centers that provide pediatric anesthesia, there we go to sleep with a mask. There's no needles. You say needles, everybody freaks out. So, you got to find the vocabulary that's right for that age group person. So again, it's kind of like preparation, I guess.
Yeah,
And
yeah.
I think it's important too for the parents to understand, this is how the day of surgery will go. This is where I'll see you. then we'll perform the surgery, then we'll come meet you, we'll get you and either take you to the ICU or to the recovery room, and then the rest of your stay will go like this. Like, I think it's very important to have in your mind kind of how the day will progress and what will be going on, and that includes updates from the operating room. And I've said it before on this talk, but I think it's just communication, and the parent just wants to know that everything's okay and it's all proceeding as planned. And if you can communicate well, I think it avoids a lot of issues later on.
Absolutely. 100%. So I agree with that. My next question is a little bit of a fun one. Now that you've gotten to work with craniofacial patients for some time, what is your favorite thing about working with the facial difference community?
I would say it's two things or two and a half things. The first is it's kind of a twofer. You're treating two people. You're treating the patient and then the parents. Sometimes their concerns align, sometimes they don't, and you have to walk both of those worlds. In terms of the facial differences, to me, it's the apex of plastic surgery because there are bony issues, there are soft tissue issues, there are functional issues in terms of speech and breathing and protecting the globes and things like that. So you really have to like think of everything going on at the same time and then predict how is the intervention now going to hold up or change over the next 10 or 20 years. It's like surgery in the fourth dimension. And also there are a lot of other things that are going on in some of the facial difference communities or conditions. Maybe there are hearing issues or GI issues, and so you almost get to like have like a more medical component to your care. So it's more than just like I see, I cut, I take care of afterward. It's almost every aspect of medicine, like psychology, medicine, surgery, all bundled into one. But I think by far the absolute coolest thing is, and I get to see this because of my partner's practice, you know, kids that he did surgery on 20 years ago. And he shows them the pictures when they were a little baby. And he explains to them, this is the condition that you had, and this is what it means for you moving forward. And it's just, I don't know, it sounds maybe, I don't know, it's just like the neatest thing for me to watch those interactions and think, man, I can't wait for that day.
Yeah. Oh, that is one very special part about just doing the work we do. We get to see the kids grow up too and change and grow in their confidence and grow in their just ability to be change makers in the world. So I'm with you. Awesome, awesome. Well, those are my heavy hitting questions. I have just a few now. This or that questions because
Yeah,
you
by
know
all means, by all means.
these are the fun and silly ones. So, scary movies or funny movies?
Oh, okay. I like scary movies, but I'll only, Samantha's my wife. I'll tell her, all right, we can only watch it during the day.
Good for you. I can't watch a scary movie. Okay, you can go other on this one, but mountains or the beach or
Ooh, that's a tough one. I'll tell you, I would respond to your question with Salt Lake City. And that's because it's one of the only places in my limited maybe experience where you can ski in the morning and then play golf in the afternoon, which
yeah.
I think is pretty darn cool.
Yeah, it is a beautiful place. I like Salt Lake as well. Good answer.
Like, listen, if we're planning a beach vacation, I won't, don't twist my arm. But I think, I grew up skiing, so that's a special place for me.
Nice, nice. Awesome. All right. This one is football or baseball or
Okay, again, I grew up in a city when if Michael Jordan didn't exist, the Utah Jazz would have a couple of rings. And I remember watching Stockton and Malone and Jordan and Pippen when I was a kid. I remember those games in the late 90s. So probably basketball. But more recently, again, my wife is like a diehard Steelers fan.
Okay.
Her dad's had season tickets since he was like in middle school. So I learned a new thing kind of later in life. I learned all about football and watching football and the players' names, and and, kind of became a football fan in my 30s. So I guess football now. I don't watch basketball much anymore. So I'm like an evolving sports person, maybe, I
There
guess.
you go. Well, we don't have too much longer to wait for football season to start back up, so we're almost there. All right. Pizza or tacos?
Ooh, that's a good one. Uh, I don't know. I'm just gonna have to pull the trigger on this. Pizza.
Okay. Awesome, awesome.
I'm unusual. I like pineapple. I like Hawaii. What is it? A Hawaiian pizza. So pineapple and ham. I don't.
Yeah.
It's not his favorite, but hey, whatever.
That was the only pizza I didn't like until this year, and I have come around. My whole family loves it. Everybody loves it. And finally, I guess I was just hungry enough one day. I ate some and I was like, not bad.
It's the salty and sweet. It's weird.
You got to put a little bacon on that, and then it's perfect.
Try that.
And last one, cookies or ice cream? Or
Ice cream, hands down. Ice cream's my 100% most favorite dessert on planet Earth.
yeah, what flavor?
So it kind of depends. Sometimes just plain Jane vanilla I like, but this is going to sound so silly. The only input I had on our registry when we got married was I wanted an ice cream maker, and thank
Okay.
God somebody did that for us. And so we've been experimenting, and we just made dulce de leche gelato.
Uh-huh.
So that's probably at the top here, but
Yeah.
vanilla is cool too.
Well, that sounds good. Yeah, and making your own, even better.
I think I tell all of the people in our office, like with their kids, it's like a fun activity because it
Mhm.
takes a year or two, and there's something involved. I don't know.
Nice, nice. Well, hey, you are clearly creative in multiple realms of your life, so that's fun to get to do that. Awesome. Well, that's all of my questions, but I always like to ask, is there anything else you want to share with our audience? You know and love the facial difference community. Is there anything you would like to share with them?
The only thing I would say is it's like a tremendous honor to be able to do this and to be able to do what I do. And you know, the school is tough, the residency is tough, the fellowship is a different sort of experience. But at the end of the day, like I feel, and maybe I'm biased, but I have a job that I love. I drive to work thinking about, that I'm happy to get there and what I have set up for the day. And, I can't imagine being anywhere else. And, I'm excited to help people for the next 30 or 40 years. It's going to be awesome.
It really is. It really is. And thank you so much for talking to us today, getting to know you a little bit better and share your answers with our community. And if people want to work with you in a professional capacity, see you as their doctor, do they visit the Craniofacial Center website? Is that a good way to book an appointment?
They can certainly do that, or the easiest thing for them is just to call 972-566-6464. That's the office phone number, and the office, again, I'm biased, but the office is wonderful, and we'll get you sorted out and taken care of, and no problems at all.
Awesome. Well, thank you so much, Dr. Coombs. It's been absolutely a pleasure to talk to you. And I know everyone will enjoy learning a little bit more about you. So thanks for being with us today.
Thank you so much for the opportunity. This was fun.
Thank you.